The retirement gap nobody plans for is the quiet killer of dreams. Most people think retirement planning is strictly about your investment portfolio, Social Security timing, and safe withdrawal rates. But the real retirement killer between the age of 55 and 65 can be healthcare. You may have enough money to retire early until one medical bill changes the math forever. The most dangerous retirement years financially may not be after 80. They might be the years before Medicare. In the next 29 minutes, you will know the major healthcare options, the hidden traps, and how to avoid overpaying. Stay tuned because near the end, I will show the early retiree healthcare decision tree so you know exactly which option fits your specific situation. Medicare usually begins at age 65, but many early retirees leave work years before then. That creates a coverage gap that can drain a brokerage account faster than a market crash. The problem is not just premiums. It is the combination of premiums, deductibles, prescription costs, narrow networks, dental and vision gaps, travel coverage, and common income-based subsidy mistakes. Leaving employer coverage changes everything because you are no longer just a name on a group list. You are an individual responsible for the full cost of your care. Why I Am Healthy is not a healthcare plan. One spouse retiring before the other can complicate coverage further. This decision affects your taxes, Roth conversions, withdrawal strategy, and monthly cash flow. By the end, you won't just know your options. You will know which questions to ask before you retire. Let's look at the big map of your main healthcare options before Medicare. You can stay on employer coverage through a working spouse, or use COBRA after leaving your job. You can look at the ACA marketplace or private off-exchange insurance. Some choose part-time work with benefits or health-sharing ministries and alternative plans. There is also Medicaid for very low-income retirees, short-term health plans, or even self-insuring small costs while protecting against catastrophic risk. Some of these sound cheap but are dangerous. Others look expensive but can become surprisingly affordable depending on your income. If one spouse keeps working, their employer plan is often the simplest bridge to Medicare. This is usually the cleanest solution because the transition is seamless. However, family premiums can still be expensive once the employer subsidy for the retired spouse drops away. You must check the deductibles, networks, and out-of-pocket maximums before assuming it is the best deal. The working spouse's retirement timing becomes a healthcare decision, not just a lifestyle decision. Before either spouse retires, request the exact employee plus spouse premium and out-of-pocket maximum. But if both of you are leaving work, this next option is where many retirees get shocked. COBRA is simple but often painfully expensive. It lets you keep your employer plan temporarily after leaving a job, but the retiree often pays the full premium plus administrative fees. COBRA feels safe because you keep the same doctors, the same plan, and the same prescriptions. It feels expensive because your employer no longer pays 60 to 80% of the bill. COBRA makes sense if you have a short bridge of 18 months or less, if you are mid-treatment for a surgery, or if you need access to very specific specialists. It rarely makes sense as a long-term, multi-year gap before Medicare. COBRA is not always bad, it is just rarely the cheapest long-term answer. The ACA marketplace is the early retiree power tool. This is often the core of early retiree healthcare planning because subsidies depend on income. Marketplace plans are grouped into bronze, silver, gold, and platinum tiers. Premium tax credits may reduce monthly premiums significantly depending on your household income. Silver plans may even have extra cost-sharing help for lower-income households. Your retirement withdrawals can affect your healthcare cost because Roth withdrawals, taxable brokerage withdrawals, pensions, dividends, capital gains, and IRA withdrawals all change the subsidy picture. Healthcare planning and tax planning are permanently connected here. A retiree who pulls too much income in 1 year may lose subsidies or pay thousands more for the same plan. This leads to the hidden ACA trap: income management. Early retirees often think they are ineligible because they have high assets, but marketplace affordability is based on income, not total net worth. There is a massive difference between your assets and your taxable income. A retiree with a $5 million brokerage account may still qualify for huge subsidies if their taxable income is controlled. Selling investments or taking large IRA withdrawals can change the calculation instantly. Consider two retirees with the same net worth. Retiree A pulls mostly taxable IRA income and pays full price. Retiree B uses a mix of cash, Roth money, and taxable brokerage assets to keep their income low. Their healthcare costs look very different. Do not retire early until you know your projected healthcare income number. Private off-exchange plans work for some, but they usually do not come with ACA marketplace subsidies. People look outside the marketplace for broader options, different networks, or specific doctors that aren't on exchange plans. You must compare the total cost, not just the premium. A lower premium does not always mean better value if the out-of-pocket maximum is massive. Check exclusions and prescription coverage carefully. Never compare plans by monthly premium alone. Compare premium plus deductible plus out-of-pocket max plus doctor access. Some solve early retiree healthcare by working part-time. This semi-retirement option can reduce portfolio withdrawals and delay full retirement without feeling like full-time work. Some employers offer healthcare to part-time workers, though rules vary by state and company. This works especially well for people retiring in their late 50s or early 60s. This is not a failure of your plan. This is using a small amount of work to protect a much larger retirement nest egg. Be careful with health sharing, short-term plans, and too good to be true coverage. These alternatives may appear much cheaper but often do not offer the same legal protections as comprehensive insurance. Health sharing plans may not guarantee payment like regulated insurance does. Short-term plans may exclude pre-existing conditions or important preventive coverage. Some plans look affordable until you actually need them to pay a six-figure hospital bill. Read the exclusions before trusting the premium. The cheapest plan can become the most expensive decision of your retirement. If your income is very low before Medicare, Medicaid might be an option. Medicaid rules vary significantly by state. It is a path for some, but asset and income treatment can be complicated depending on where you live. This is where professional guidance is often needed. Check your state rules before assuming you do or do not qualify, as some states expanded Medicaid while others did not. The HSA, or Health Savings Account, is the strategy retirees often forget. If you are eligible through a high-deductible health plan, the HSA is a powerful planning tool. Contributions are tax-advantaged, and the money can be used for qualified medical expenses tax-free. Some retirees use HSAs as a long-term healthcare reserve, letting the money grow for decades. You generally cannot contribute once enrolled in Medicare, so max it out while you can. Save your receipts if you are using an HSA strategically to reimburse yourself later. This is one of the few accounts that can help with healthcare and taxes simultaneously. Medicare changes the healthcare equation at age 65, but it does not mean healthcare becomes free. You need to understand Part A, Part B, Part D, Medicare Advantage, and Medigap. Missing your initial enrollment windows can create permanent penalties and coverage gaps. Early retirees should start researching the transition at age 64. The goal is not just surviving until Medicare. The goal is arriving at Medicare without making expensive, irreversible mistakes. Walk through the early retiree healthcare decision tree. Check if you or your spouse qualify for employer coverage. Yes? Compare that price first. Second, COBRA can provide short-term medical coverage if you quit your employment. Third, compare ACA marketplace plans for numerous years before 65. Fourth, verify income flexibility. Plan withdrawals to maximize subsidies. Fifth, are there specific doctors or medications? Check networks and formularies before signing. Sixth, before choosing an inexpensive plan, read the exclusions and worst-case expenses. Finally, begin your Medicare transition plan within 12 months of turning 65. Avoid these 5 early retirement healthcare plan killers. The biggest mistake is retiring before understanding your healthcare premium. Second mistake, focusing on monthly costs instead of financial danger. The third mistake is disregarding pharmaceutical coverage, which can cost more than the premium. The fourth mistake is taking too much taxable income and losing thousands in subsidies. Mistake number 5 is believing Medicare will fix all financial issues at 65. Before early retirement, do these 3 things. Calculate your pre-Medicare healthcare gap. Compare 3 health-related coverage alternatives that fit your needs. Finally, include healthcare costs in your retirement income strategy. Watch our video on the retirement expenditures everyone underestimates to stay on track. Healthcare management is as vital as investment management. Secure your future with early planning and coverage. Comment your projected retirement age below, what you are planning to use for your healthcare needs during retirement. Please subscribe to this channel and like the video so that this information is shared with others needing financial advice. Hit the notification bell to never miss a video helping you to navigate retirement-related finances.